Cervical cancer. What symptoms should you watch for? Cervical cancer is often called a silent disease because early-stage cervical cancer usually does not cause noticeable symptoms. This is why regular screening is so important for early detection. When symptoms do appear, they often indicate that the cancer has progressed beyond the cervix. One key symptom to watch for is unusual vaginal bleeding. This can include bleeding after sexual intercourse, bleeding between menstrual periods, or bleeding after menopause. You may also notice periods that are heavier or longer than what you usually experience. Another symptom is abnormal vaginal discharge. This discharge may be watery, have a strong or foul odor, or even contain blood. If you notice any changes in your discharge, it is worth discussing with a healthcare professional. Pelvic pain or pain during sexual intercourse can also be a sign of cervical cancer. If you experience persistent pain in these areas, it is important to seek medical advice. As cervical cancer advances, additional symptoms may develop due to the spread of cancer to surrounding tissues or other parts of the body. You might experience painful or difficult urination, or even blood in your urine. Similarly, painful or difficult bowel movements or rectal bleeding can occur. Other symptoms to be aware of include a persistent dull backache or abdominal pain, swelling in the legs, and general symptoms like fatigue, weight loss, or loss of appetite. Remember, these symptoms can also be caused by other, less serious conditions. This is why it is essential to consult a healthcare professional promptly if you notice any of these signs. Early medical evaluation allows for timely diagnosis and improves the chances of effective treatment. Regular cervical cancer screening through Pap tests and human papillomavirus testing remains the most effective way to detect precancerous changes before symptoms develop. Screening guidelines typically recommend starting at age 21 and continuing at intervals advised by healthcare providers. In summary, the main symptoms to watch for are unusual vaginal bleeding, abnormal discharge, pelvic pain, and symptoms related to advanced disease such as urinary or bowel difficulties and leg swelling. Awareness of these signs, combined with regular screening and prompt medical consultation, is vital for early detection and management of cervical cancer.